Good evening, dear viewers. Welcome to This Week in Turkey. We're sorry for the delay. As you can see, we are in our new setup. Medyascope has shut down its studios as of tonight, but our broadcasts will continue from our respective homes. Obviously, this week, our agenda is Turkey's fight with the coronavirus. Turkey confirmed its first case on March 11th. Since, there have been 4 deaths, and the total number of cases testing positive has risen to 359.
The first death related on the coronavirus pandemic was reported on March 17. Health Minister Fahrettin Koca stated that it was an 89-year-old male who had died after contracting the virus from an employee who had contacts with China. The second death is a 61-year-old male. The third, confirmed by Koca on March 19, is 80-year-old former Land Forces Commander General Aytaç Yalman. Professor Sinan Adıyaman, the Central Committee Chair of the Turkish Medical Association, stated that Turkey has to conduct more coronavirus tests to accurately determine the number of infected people in the country. In a written statement, the association said that 3 conditions must be met to successfully tackle the outbreak: identifying and isolating infected people and people who contacted them, determining how widespread is the disease in the country by performing enough number of tests, and organizing the healthcare system to respond to the rapidly increasing number of patients. Further, the association voiced concern about the availability of masks and other protective equipment against the coronavirus outbreak at health centers. Adıyaman said there are hospitals that have only a week's supply of masks and gloves left. Moreover, it has been announced that internist Professor Cemil Taşçıoğlu from Istanbul Çapa Faculty of Medicine and pulmonologist Professor Bülent Tutluoğlu have tested positive for the virus, raising concerns over the conditions of health workers and hospitals. Concerns were also raised regarding the capacity of intensive care units. Koca said that Turkey has 99,797 single bedrooms that may be used for isolation or intensive care for patients, adding that the country has 25,466 intensive care beds for adults. There is also concern regarding the low number of test kits. In Istanbul, a city of over 18 million residents, only 4 hospitals can currently provide the tests. Koca on Thursday stated that fast diagnosis kits brought in from China will be available in all provinces as of Friday, March 20, and that they aim to conduct 15,000 tests daily.
This evening we have Dr. Özlem Kurt Azap on our Zoom line. Dr. Azap is a member of the Turkish Medical Association's Coronavirus Inspection Group, as well as a doctor at the Department of Infectious Diseases at Başkent University in the Turkish capital of Ankara. Good evening, Dr. Azap. Thank you so much for joining us this evening.
Thank you. Hi.
I would first like to ask you how the situation is at your hospital in Ankara, and how has your daily routine been affected since the first case of coronavirus appeared in Turkey?
Yes, in fact, from the mid-January, we have been dealing about this issue. I mean, the coronavirus first epidemic maybe, but from 11th of March, as it's announced by the WHO, it's a pandemic. But of course, from 11th of March till now, I mean, for the last 9 days, we are dealing more closer with the situation, because after the first case, the cases rose very sharply and maybe doubled day by day nearly. And now we have, unfortunately, 359, but I think this evening it will increase, and 4 deaths are announced today. So first of all, in mid-January, we were trying to arrange some theory. I mean, we are trying to be prepared for the pandemic, but it was not as close as now. We have just made some groups in our hospital and planned what to do if the cases arise in our country. Besides my daily routine in the hospital, we are trying to arrange the national plan in TMA, Turkish Medical Association, because the pandemics generally are not welcomed in the, of course, community, and everybody gets very panic. And we are trying to both slow down the panic and trying to arrange and trying to be prepared for this pandemic.
Well, the health ministry has argued that not disclosing the location of the cases was important because of patient confidentiality, but obviously others say that this is a lack of transparency on their behalf. So what is the importance of disclosing these locations?
Transparency is the first point in the management of the pandemics, because you are getting a very, pandemic means you are in a very big trouble, and you can just manage some solutions or just slow down this great problem by the help of the community and by the help of the healthcare workers. If the transparency doesn't work, nobody will trust the ministry, the government, and then you can't do what you are trying to do. The health ministry says it's an issue of patient privacy, but it's not exactly that. We are not asking about the name of the patient, but the cities, the provinces are important because the close follow-up is necessary in this situation. And maybe if the city, but name of the city is described, the patients, the people will say that, oh, I was there last week and I have now fever and cough. I should go to the doctor, maybe. And this is not only for Turkey. The need for transparency is not only for Turkey. For example, we learned the cases in Italy, first in the northern part of Italy, and we all learned the names of the provinces which the first cases take apart. So it is the most important part of the management of the pandemic. I hope in the coming days, we will be able to learn, but still we don't know, even the numbers are increasing, we still don't know the names of the cities.
As you mentioned, Dr.
Informally, because everybody knows what's happening, but it's not announced formally.
Yes, it's important to know the location for both transparency and for follow-ups and further precautions. As you mentioned, Dr. Azap, there has been an increase in the number of cases, almost doubling every night. Could you perhaps summarize what are some of the most pressing issues facing both hospitals and doctors and how they could potentially be overcome in this process?
Yes, the cases are increasing in Turkey, but also, of course, all over worldwide. Mm-hmm. You know, the first 100 cases, it took 3 months to see the first 100 cases in the world. It was, I think, 8th of March. It was the total number of the cases were almost 100, but the second 100 took only 12 days to reach. The WHO director of the WHO announced this today. You know, WHO releases situation reports daily, and this today's report is pointing out this issue, mentioning this because the problem is a worldwide problem. So, of course, we will see the increasing. A very sharp increases in the case numbers. Maybe we are not, of course, happy with this, but we should be prepared more than panic. So, first of all, we will try to find the cases in our country. What I want to mean that when a case is confirmed, when a coronavirus infection case is confirmed, it means that there are 10 more cases in the population, in the community. This is a report from China which calculated this ratio, but it's logical, 1 to 10. So if we say that there are this number of cases, we should multiply it by 10 to see the real situation. So by calculating these and by close follow-up the regions, the provinces, some plans should be taken at the province level, city level, and the national level. One of the most important issues to be taken first is the wide use of the rapid antigen or rapid whatever tests, because we can't diagnose the illness, the COVID-19 illness, only by clinical or physical findings. We need a test to confirm. And you know, at the beginning, there was only one center in Ankara, the central laboratory, the reference laboratory, of course, but it was only one. Then just 2 or 3 weeks ago, there were 2 or 3. Now the minister said the numbers are increasing, and the total number of the tests in Turkey were 10,000 just yesterday, the whole time, from the whole period. But from yesterday till today, almost 2,000 tests were performed. And the health minister said the number of tests per day will be increased to 15,000. Of course, it should be calculated whether it will be enough or not while comparing the cases, the total number of the cases. We'll see. Of course, it's more than, or I mean, it's bigger or greater than this number. The total number is 10,000 just yesterday. 15,000 a day, 15,000 tests a day is a really big number, but maybe we will need to increase more. It's said that there are 50 centers in Spain, test centers, and it's almost 100 in South Korea. Now, in our country, it's just increased to 16, 17, maybe 19, just today or tomorrow. And it's not only the number. Yes, we will number the test centers, but also the capacity should be increased. And for example, for some cities like Istanbul, only one center is not enough. It's a population of maybe 20 million. So maybe 3, 4, 5, I don't know how many, but more than one centers are needed. I think health minister said there will be 3 centers, but maybe big 3 centers will be enough. I'm not sure, but we know that the how fast you diagnose the disease, then that much you can isolate the patients and you can stop the communicable part in the population.
You mentioned isolation, Dr. Azap. On that point, there's also the issue of prisons, where bar associations are proposing that certain judicial measures be taken, for example, house arrest and so forth. How could the sanitary conditions in these confined environments be improved or addressed?
Yes, as we are talking more commonly about social distancing, as WHO announced, after the pandemic is announced, we have 3 important things to do. One of them is the preparedness of the hospitals, the intensive care units. The second one is testing more and more, test, and isolate the cases, confirmed cases. And the third one is to stop the contagiousness of the disease between the people in the population. When we come back to prisons, the people are very close to each other and in closed environments and very close. The 1 meter is our goal to be between. I mean, there should be 1 meter between 2 people to say that social distancing is okay. In prisons, it's not easy. And also not only the direct contact, but also the indirect contact with the infectious fomites brings the disease to people. So the surfaces should be cleaned very often. It's obvious that these are not possible in prisons. I think the people in the prisons should be categorized into very urgent ones who are very ill and should get affected more severe than the others. The ones with underlying conditions, severe conditions, should be definitely out of prison, and the other ones should be detailed, should be evaluated by file. I mean, if the files of the prisoners are not an obstacle to be outside, they should be in prison. They should be out of the prison.
Mm-hmm. And at this point, Dr. Azap, what can Turkey learn from other countries' fights against coronavirus? What are some of the required forthcoming measures, do you think, on both on a personal scale and both more on a national scale?
Yes, from now on, personal scale is really very important, because it's said that stay at home for particularly the ones elder than 60 years, and for the ones with underlying disease, stay at home and don't go out if you are not obliged to. And the other important group is the school students and the university students. All are closed, but this doesn't mean that they have a holiday and go out to shopping centers, to cinemas. I mean, it's not an opportunity to get together. It's an opportunity to be at our home to fight against the disease. So the personal level is very important for getting the success. For example, there are still some restaurants serving. It shouldn't be, really, because one meter is our goal to maintain between two people. But in crowded restaurants, there are many people living together. It's not really fair, for not only for those people, also for the well-being of the whole population. This is not a personal problem. This is a problem of the community, and everybody should do his or her best to achieve this goal. At the national level, increasing the number of test centers, along with increasing the capacity of these centers, and for the patients, I mean, for the people suspected to have COVID-19, people should get test service from the hospitals or family medicine centers. They should be, if that patient will get a treatment at hospital, he should be hospitalized very quickly. But many of the, 80% of the population of these patients don't need hospitalization. They feel well and they can stay at home till getting better. To decrease these risks, Health Minister has made a phone center, 186. It's a center. It was a center before for the patients to tell their, advisors through this center. But now it's a coronavirus center, 184, not 6, 184. And when you call this center, they will inform you and they will guide you what to do. Maybe they will say that stay at home. You don't have to go to the hospital, or they will say that go to this hospital and to this clinics. If a patient is not very ill, so he will stay at home and will not be in touch with anybody, only by phone call. And he won't, for example, of course, we have family members. The family members will not be closer, not be 2 meters closer than this. They will preserve the 2-meter distance with this patient.
Mm-hmm. Okay, Doctor.
And of course, by hand hygiene, hand washing, hand hygiene is very important. In addition to be far.
Yes. In addition to the social distancing. Dr. Özlem Kurt Azap, thank you so much for making the time to join us this evening under the current circumstances. We wish you all the best.
Thank you very much.
Thank you. And now for a quick roundup of the measures taken by Turkey to prevent the spread of the coronavirus.
The government has taken a series of precautions against the spread of the virus. In addition to the closure of schools and universities starting March 17, the Interior Ministry shut down all cafes, wedding venues, cinemas, theaters, restaurants, concert halls, performance centers, gyms, internet cafes, and indoor playgrounds. In a statement, the ministry also said that all gatherings and activities by non-governmental organizations will be postponed. All funeral gatherings traditionally held at homes are also banned to simulate more social distancing, the ministry said. The Directorate of Religious Affairs also suspended all congregational prayers in mosques, including traditional Friday prayers. Including the Friday prayers, congregational prayers will be suspended in mosques. During this period, instead of Friday prayers, Muslims can perform noon prayers at home, Diyanet head Ali Erbaş said. Erbaş further stated that mosques will be kept open for individual prayers. Thousands of Muslims returning to Turkey from a pilgrimage in Saudi Arabia were taken into quarantine on March 15. Thousands of students residing in dormitories belonging to the Higher Education Loans and Dormitories Institution were told to leave the dorms at midnight, with some unable to gather their belongings. Meanwhile, prosecutors have launched an investigation into a news report on pilgrims who allegedly did not undergo a medical checkup upon their return to Turkey. The news report said about 500 pilgrims were directly sent home, with several of them defying the 14-day quarantine rule and spending their time outside their houses despite the calls of the authorities. A total of 28 pilgrims were caught in the central Anatolian province of Çorum after escaping from quarantine. Further, Vice President Fuat Oktay said on March 18 that a total of 2,807 people were evacuated at their request from 9 European countries. Oktay said those returned will be put under 14-day quarantine in dormitories located in Istanbul and northwestern province of Kocaeli. Oktay also commented on a footage circulating on social media that showed 2 people taken out of a bus to avoid quarantine. Investigation was launched into the acts that are against quarantine conditions during the evacuation process, he said. On March 19, the Interior Ministry announced that the country will close its land borders with Greece and Bulgaria to passengers. However, the gates will still be open for freight transportation. The chairman of Turkey's Council of Higher Education announced Turkish universities will start online classes on March 23. Schools that possess the necessary digital equipment will be holding online classes online, and the council will provide remote education material to other schools. He also said that the Turkish Radio and Television Corporation will be providing the council with an airwave to broadcast classes that would reach a broad audience. 33 bar associations have called on the government to release prisoners, suggesting that the execution of sentences should be suspended or judicial control measures such as house arrest should be implemented. There are more than 270,000 prisoners in 375 prisons in the country of 80 million, according to mid-2019 figures by the Turkish Statistical Institute. The fact that coronavirus transmits through droplets in the air makes prisons more dangerous for the spread of the disease. The bar associations stress that the prisons in Turkey have more inmates than their capacity. The prisoners have very limited access to cleaning supplies and disinfectants, and there were thousands of ill, older, women and child prisoners. Urgent and comprehensive measures should be taken and solutions should be developed in order to effectively combat this epidemic and minimize potential life-threatening risks, said the Bar Association in a statement.
On March 18, 1 week after the first domestic COVID-19 case was confirmed, President Recep Tayyip Erdogan made his first major address. Erdogan unveiled a package of financial measures to shore up the economy against the coronavirus impact.
In a news conference, Erdogan said Turkey would postpone debt payments and reduce tax burdens in various sectors under a 100 billion lira package. Erdogan called on banks not to limit loans and for companies not to cut jobs, while vowing to support Turkish Airlines. Among specific measures, he said Turkey's accommodation tax was being suspended until November to support the key tourism sector, which accounts for some 12% of the economy. Debt payments of companies affected by the coronavirus will be postponed for a minimum of 3 months, while value-added tax and social security payments for various sectors will also be deferred for 6 months, Erdogan said. He added that value-added tax for domestic aviation was cut to 1% from 18%, and there would be a doubling to 50 billion lira in the limits of the Treasury-backed Credit Guarantee Fund, which guarantees loans to small and medium-sized firms. He urged employers to encourage flexible and remote working models to stem the spread of the virus. He added that the lowest pension amount has also been increased to 1,500 Turkish liras. After Erdogan's announcement, clothing retailers including Mavi Giyim and Vakko Tekstil stated that they were closing their retail stores until further notice, despite the fact that shopping malls themselves have not been closed. Erdogan also advised citizens to practice social distancing and stay at home if possible, without announcing additional measures to restrict movement.
In other news, U.S. Secretary of State Mike Pompeo said on March 17 that the U.S. believed Russia to be responsible for the killing of dozens of Turkish military personnel in the course of its operations in Syria. Russia responded by stating that the U.S. was spreading lies.
Speaking at a news conference at the State Department, Pompeo did not specify where or during which incident the Turkish soldiers were killed. It was the first time Washington has directly pointed its finger at Moscow over the death of Turkish soldiers. We believe Russia has killed dozens of Turkish military personnel in the course of their military operations, and we stand with our NATO ally Turkey, and we continue to consider additional measures to support Turkey and to end the violence in Idlib and in Syria more broadly, Pompeo said. In response, a Russian Foreign Ministry official said the United States was spreading lies to disrupt Russian-Turkish relations. Last month, an airstrike that Ankara said was carried out by the Syrian government forces killed at least 34 Turkish soldiers, the deadliest attack on the Turkish army in nearly 30 years. The governor's office in Turkey's central Sivas province said on March 18 that one Turkish soldier was killed in Idlib. Turkey and Russia, which back opposing sides in Syria's war, agreed on March 5 to halt hostilities in the country's northwest after a recent escalation of violence displaced nearly 1 million people and brought the two sides close to confrontation.
The Ministry of Defense actually announced last night that the number of dead soldiers in the March 18 attack was not 1, but 2, with another wounded by the rocket attack. The Justice Ministry has assigned inspectors to investigate the reported physical abuse that was inflicted upon Oda TV's editor-in-chief Barış Pehlivan in prison. The move came after Pehlivan filed a criminal complaint against a prison guard who he said battered him upon his arrival at the Silivri prison on March 6.
Ministry inspectors have analyzed the security video footage reportedly showing Pehlivan having been battered late on March 6 upon the journalist's arrival at the Silivri prison, Oda TV said on March 18. The inspectors have also taken the testimony of Pehlivan in prison. the Istanbul Chief Public Prosecutor's Office earlier this month denied the claim by Pehlivan's lawyer, Hüseyin Ersöz, that the journalist had been beaten by prison guards. Pehlivan was formally arrested on March 6 over a news report covering the funeral of a member of Turkey's National Intelligence Organization killed in Libya. Pehlivan faces charges of disclosing the identity of the intelligence agency official, even though the name had been revealed by an opposition lawmaker previously. Oda TV news director Barış Terkoğlu and reporter Hülya Kılınç have been also arrested for the same reports.
That's all from This Week in Turkey. See you next Friday at 9 p.m. In the meantime, stay safe, practice social distancing, and be well, dear viewers. Good night.